Hello, thank you for joining me today to discuss our deep core and our pelvic floor. I'm Terry Lynn Heath, and I will be your host today. If you have not done so, even if you're watching a recording of this or joining live and you haven't done so, please take a moment and register at www.themovementpath.com/lunch-and-learn because I will be able to send you the full-length instructional videos that accompany all of the material that I will provide today. I do go through truncated versions of the movements, but I would really love to be able to send you full videos with audio and instruction to support your pelvic floor health. So during our time together today, we will talk about the 3 layers of muscle that comprise the pelvic floor and what each layer is responsible for, the risks relative to the pelvis that occur during pregnancy, childbirth, and menopause, the role of pelvic physiotherapists versus that of coaches, how exercises and breathing techniques can impact the pelvic muscles, and lastly, exercises you can start today that will improve your awareness and the strength and tone of your pelvic floor. But first, a little bit about me, as is customary. I would like to take a minute and introduce myself to you so that you know why I do what I do. It is my mission to empower women to understand the control they have over their health through movement. This is me with my 13-year-old daughter, my pride and joy, my struggles with fertility, and the fact that 5 of 6 of my direct ancestors have passed in their 60s has defined my path to live an incredibly healthy life. My ultimate goal is to enjoy a health span of 105 years, to be here as long as I can with my daughter and beat the odds. Every choice I make is measured against this goal. So here we are. Through my studies and my work, I understand how much control we have over our health, and I am passionate about sharing information to help us get to know our amazing bodies. By becoming aware of their functions, we can manage them with more care and compassion and redefine our relationship to our one precious body. Today in the US, women do not have the right to choose their reproductive outcomes in many states, only reinforcing the disconnection with our bodies. But by discussing subjects like menopause and the vital functions of the pelvis, we can begin to reclaim our power and obtain the support system we need. In my practice, I seek to empower women to become champions of their self-care. My scope of practice, I like to say that I am not a one-stop shop, and I'm honored to be one stop along your path. I have a large network of professionals to refer to. If you need support, please reach out after we conclude here, and I will do my best to help you get the care you need. If you are a women's healthcare professional and would like to be included in my referral network, please reach out as well. Here we go. But one more thing before we get started. The information provided in this session is for educational purposes only. It is not to be utilized as medical advice. By continuing this session, you agree that the actions you take during and after the session are your full responsibility and not the responsibility of the Movement Path or of Heath Global LLC. Thank you very much. So what is pelvic health? This definition of pelvic health is from the Baylor College of Medicine. Our pelvic health is considered paramount to our overall health, since it houses so many organs and performs so many functions, including sitting, walking, running, and creating and birthing life, to name just a few. It is in our best interest that it is in its optimal condition. Simply put, your pelvic health contributes to your overall health. Here's a little look at what we have going on. This is the anatomy of the pelvis. Take a moment or two and take all of this in. What I'm struck by is the incredible job of the muscles in our pelvis responsible for holding up our organs. Over here on the left, we see a side view, and you'll see that red layer there at the bottom is 3 layers of muscles that supports all of our organs. On the right are the layers of the pelvic floor attached to the pelvic girdle with connective tissue. The muscles of the pelvic floor stretch somewhat like a hammock between 4 points, from the coccyx to the tailbone, or the coccyx, also known as the tailbone, to the pubic bone. So that's from front to back. and from side to side or laterally connecting at the ischial tuberosities of the pelvic girdle. Now let's go a little bit deeper and learn about the three layers and what they're responsible for. First, we have the urogenital triangle, then the urogenital diaphragm, and then the deep pelvic floor. So the urogenital triangle has three muscles: the ischiocavernosus, the bulbocavernosus, and the transverse perineal superficialis. The function of this layer is relatively unknown, but assumed that it contributes to sexual pleasure and function. This layer also includes the external urethral and anal sphincters, and this layer definitely does support the other layers of the pelvic floor, so we know that. This is the urogenital diaphragm. This is the layer in between. It sits in the middle and includes internal urethral and anal sphincters, which control continence. When these muscles aren't working properly, a woman may have difficulty starting the flow of and controlling urine or feces. This is the deep pelvic floor layer. Now, this is the one that most people are familiar with or understand what you're talking about when you refer to the pelvic floor. So this is the deepest layer, the one we are most familiar with and is often considered to be two muscle groups. In this deepest layer, the muscles work together with the surrounding fascia and connective tissue to lift and support the pelvic organs, thus preventing prolapse. They also contribute to maintaining continence. So you can see that all of the layers support continence, which is a favorable function and attribute. Incontinence of some form is very common in women during pregnancy and after childbirth, and during the menopause transition and beyond. It can significantly affect quality of life, and in most cases is very treatable with the correct guidance and support. So here is that photo again, just after we have reviewed the layers and what they do. You can take a closer look at those layers in this diagram. The pelvic floor has a big job to do. It is consistently responding to breathing patterns and intra-abdominal pressure, even at rest. This is why breathing techniques can build pelvic floor control. Our core is like a canister. If you can imagine a soda can with our abdominals forming the sides and our diaphragm at the top and the pelvic floor at the bottom. A little more on this later when we practice the connection breath. But the responsibilities and the functions of the pelvic floor are to constrict the urethra, vaginal, and anal canal, provide support for the pelvic organs, help stabilize the trunk, and help regulate intra-abdominal pressure. There's a lot going on there. So let's talk about pregnancy and postpartum. Imagine all that weight on the pelvic muscles during pregnancy. That's probably why there are three layers of muscle. So here we have the effects of pregnancy and postpartum on the pelvis. Load bearing during pregnancy increases the pressure on the pelvis, the pelvic floor, and organs of the pelvis. Pressure required during vaginal birth impacts surrounding tissue and muscle fibers, increasing the risks of tearing. The increased risks of pelvic organ prolapse increases during this time, and we have the increased risk of incontinence. Among pregnant women, around 48% of those who have never given birth show signs of incontinence by week 30, and this rate increases to around 67% for those who have given birth before. So again, very, very common and nothing to be ashamed or embarrassed about. I want to emphasize that these conditions are more common than not, and we can impact them through exercise and treatment if we talk about them. Many of these can be impacted by exercise alone, so that's the great news. So let's talk about the risks of perimenopause and postmenopause on the pelvis. We see a decline in reproductive hormones causing thinning of the tissue. So that's our decline in estrogen and progesterone and testosterone. All of those things impact the thinning tissues in the pelvis. Genitourinary syndrome of menopause, which is a complicated disease and involves many things. It's also, it can be shortened to GSM. If you'd like to know more about that, we can talk about that in a separate lunch and learn, because it's enough to fill an entire hour. The possibility of low tone, poor strength, poor coordination in the pelvic muscle, pelvic organ prolapse, which is basically the falling through of or the lowering of the organs toward or through the layer of muscle. So there are different degrees of prolapse. And a pelvic physiotherapist can help you identify if you have prolapse or suffering prolapse or not. Incontinence or leaky bladder, and other pelvic floor dysfunction like difficulties emptying the bladder and bowel, and pelvic pain. Those are just a few of the risks of perimenopause, menopause on the pelvis. The prevalence and prolapse and incontinence are less known since many women are embarrassed to speak about these sensitive issues. But having conversations like this can open up the dialogue and make sure we are offering the support to women that we all deserve. Sorry about my mouse moving all over, but I don't know what else to do there. So if you think about it, our pelvic floor is under a lot of pressure for a good portion of our lives. Even if we aren't bearing children, we are subject to the effects of menopause for half our lives if we are lucky. So who can we look to for support? On this slide, you see that a little bit about physiotherapists and coaches and the difference between them. Now, a physiotherapist is also known as a physical therapist in the US. On all other areas of the world, physical therapists are referred to as physiotherapists. I hear that there's an effort to change that in the US as well and to call them all physiotherapists. So you may be familiar with a physical therapist who is versed in the entire body and treating and diagnosing musculoskeletal pain. They are good for guiding modifications for general exercise during pregnancy and menopause. They can manage pelvic floor dysfunction and conditions and guide optimal recovery from birth and surgeries. Coaches can perform initial pelvic screening in the form of questions. They can refer to a pelvic health physiotherapist as necessary. They can teach the connection breath and utilize it in training, which we'll do today. And they can encourage open communication about current symptoms and adjust programming as necessary. And they can include exercises and training to strengthen the pelvic floor. If you are having symptoms that affect your quality of life, seeking a pelvic health physiotherapist is an option for you. Coaches are also an important part of your support system. I strongly believe in coaches, and I will always have a coach of some sort. We likely will spend more time with our coaches and trainers than any other part of our healthcare team. They can be relied on to connect you to the right people based on your unique situation and can be trusted with sensitive information. Here are traits I recommend you look for in working with physiotherapists and coaches to maximize your support system and your efforts. So if you're having issues with your pelvis specifically, it is important to seek the care of a physiotherapist who is professionally trained in pelvic health. Not all of them are. So it's an important question to ask because physical therapists in the US are versed in the entire body, they may not be specialized in one area or not. So you do want to seek the help of a pelvic physiotherapist. And you can be referred by your OBGYN or your general practitioner. You can be referred by a coach. You can visit the National Menopause Society and look there for physiotherapists as well. So some traits that I recommend you look for in a physiotherapist and a coach regarding the pelvis specifically is a therapist who is trained in pelvic dysfunction and treatment specifically, therapist who is willing to work with your allied healthcare team, including your trainer or coach, and a physiotherapist who integrates joint strength function into their practice. This is the specific bias of mine based on my practice because I do know that joint strength greatly impacts muscular strength. And unless you are training the joints themselves, you may not get all the benefits that you can out of working with someone who is trained and versed in working with joints as well. In terms of coaches, a coach who specializes in working with women is recommended. A trainer who specializes in menopause or pre and postpartum coaching, and a coach you trust enough to speak with about sensitive subjects. and a coach who's willing to and understands the benefit of working with your allied healthcare team. Those are all important things to look for in a coach and in a physiotherapist. So let's talk about how exercises can heal and strengthen the pelvic floor. There is high quality research on pre and postnatal women showing that pelvic floor strengthening may help reduce the risk of incontinence as well as reduce the severity of pelvic floor symptoms during and after pregnancy. Now, there's not enough research, as we know, on menopause, and we're getting there. We're moving in the right direction, I think, and as more research and attention is being given to women, but it hasn't been long that women have even been included in research at all, even with the research being directed towards women. So we have a long way to go. And again, having conversations like this and spreading the word and spreading the awareness that more money needs to be spent researching our own health issues, the more progress we will make, I believe. Now, research shows that the strengthening of the pelvic floor should follow the same 3 principles of training used for other muscle groups, and those are specificity, overload, and reversibility. Specificity refers to the training that the training replicates the specific desired purpose. Overload refers to the muscles that are working harder than they are used to, and reversibility is when people stop training, they lose the effects they gained. Those are the 3 principles that are used in training other muscle groups and also should be applied to the pelvis. So what does this mean for training the pelvic floor? In order to understand this, let's take a look at what fast twitch and slow twitch muscle fibers are responsible for. Fast twitch muscle fibers react quickly, fatigue quickly, and help maintain continence by contracting spontaneously when there is a large increase in intra-abdominal pressure. Slow twitch muscle fibers are better at sustaining a less intense contraction over time and contribute to the tone of a woman's pelvic floor. So it is important that both types of muscles are considered in training. Fast twitch fibers are targeted with quick, more intense contractions that build strength, and slow twitch fibers can be strengthened with contractions held for longer periods of time that build endurance. Today, we will be doing basic introductory exercises designed to help you become more aware of your pelvic muscles and are mostly engaging the slow twitch fibers. So let's get moving. If you have a private space to lay down, that is great if you can follow along. If not, you can watch and listen and do many of these seated in a chair if you're at the office. Remember, if you haven't registered, please go to www.themovementpath.com/lunch-and-learn to receive full instructional videos. I'm happy to send them along, no matter if you're watching a replay or watching live. Please register so that I can get you those resources. Okay, so let's get to it with the connection breath. I'll walk you through what this is, and then we can talk about it a little more in relationship to training. So the connection breath is the opportunity to engage with your pelvic floor. It's not like a Kegel, although maybe it's a little similar, but it involves more of your breath. Remember how your core is like a soda can or sparkling water can, probably a better description for a health session here. With your abdominals forming the walls of the can and your diaphragm at the top and your core, or your pelvic floor, which is your deepest core, at the bottom. So when you breathe, those move away from each other. Your diaphragm and your core or your pelvic floor move away from each other. When you exhale, they move closer to each other. They inhale, make space, exhale, move close. Inhale, make space, exhale, move close. So they're doing that all the time. So you do have some tone in your pelvic floor, even if you're not working on strengthening your pelvic floor, just because of breathing alone. So what's important also is that the pelvic floor has an opportunity to relax. In addition to contracting, it definitely needs to be able to relax. So this breath helps you both to relax and to contract and to feel the difference between the two. So you can lie down with your legs bent, your lower back touching the floor, or you can be in a chair. So either one works well for learning this connection breath. So if you're in a chair, your feet are on the ground, you're sitting comfortably, maybe you're leaning against the back of the chair, maybe you're not, maybe you're comfortable just sitting upright, but you want to be able to relax as much as possible, relax as many muscles as possible. So choose your position, and then you want to place your hands on your abdomen. Abdomen. I'm running over that word regularly lately. So place your hands on your belly. And when you breathe in, you want to feel your hands raise and you want to feel your muscles relax as much as possible. So you're breathing in on your inhale, feeling your hands raise and relaxing everything as much as you can, and exhale naturally or reflexively. So don't force the air out. Do this a few more times. You're inhaling, relaxing, feeling that relaxation in your belly fill, and naturally exhaling. As you inhale, try to feel your pelvic floor relaxing. Feel your chest relaxing, feel your belly relaxing, just naturally pushing out on that inhale. A couple more times. Remember how your pelvic floor moves down naturally as you inhale to make space for that air, and how it naturally rises up a little bit as you exhale. So now, as we've gotten used to what the inhale feels like and relaxing your muscles feels like, now we're going to contract the pelvic floor on the exhale. So you're going to stick with that relaxation on the inhale, and then on the exhale, either through your nose or through your mouth, try to engage the pelvic floor and try to lift it towards your belly button. Again, relaxing on the inhale. As you exhale, contract the pelvic floor, draw it up a little bit towards your belly button. Let's try that a few more times. Inhale, relax. Exhale, draw that pelvic floor up. You can even pretend you're pulling a tissue out of a box with your vagina. Trying to get whatever visual works for you to engage those muscles. They might be hard to find, and if they are, don't worry. Doing this a few more times will likely help you connect with your pelvic floor. If not in this session, then I'm sure in sessions to come if you stick with it. So inhale, relax your belly, exhale, pull your pelvic floor towards your belly button. Let's do it one more time. Inhale, relax. Exhale, pull your pelvis towards your belly button. And that just helped me relax because like it's the connection breath, but it's also very similar to diaphragmatic breathing, which stimulates your vagus nerve, which is great for helping you calm down. So I just like took a mellow break just now, even while giving a presentation. So it's a great tool. So that's the connection breath. Once you have this down, it can be used with exercises and integrated into your strength training. It is recommended that the connection breath is included at least once in each training session and paired with one exercise. So I'll give you an example of what that would look like. It doesn't even have to be an exercise that involves your pelvis, which is very cool. So take a bicep curl, for instance. So upon the relaxation, or upon the eccentric movement or straightening of the arm of the bicep curl, that's the easier part. The eccentric is easy, and the concentric is hard because you're lifting that weight. So upon the concentric movement is when you would engage your pelvis, your pelvic floor, and pull it up. So on the eccentric, think about that easy inhale, the easy relaxing inhale, and on the exhale, you're also providing pressure on the bicep, and you're pulling up your pelvic floor. So that's one example of how you can pair the contraction of your pelvic floor with an exercise, any exercise, which is very cool. So let's get into some movement. This is I'm going to walk you through just examples. They're short little videos. And as I said, the longer videos that include all of the instruction, rather than me talking over them, would be emailed to you if you sign up using that link. So you can go to the Movement Path website and find the link there, or you can go to the address that I have shared with you. I'm not going to share it with you right now again, but I will at the end of our time together. So this is a windshield wiper, and you're leaning back onto your hands or you're leaning against a wall. And the object here is to apply pressure into the hip capsule of each hip by moving your legs with tension from one side to the other. But you're not pinning your sits bones or your hips down to the ground. You are letting them move freely with your legs, but you're also applying pressure as you move from one side to the other. So you're thinking about your legs being allergic to one another. You're lifting, moving one leg as far as you can before you have to move the other leg to move through your movement. So that pressure applies pressure into the hip capsule, which lends to the strength and the flexibility and the function of the pelvic floor muscle. I'm trained in joint strength training, so this is particularly important to me that we include the hips in any training program to support the pelvic floor. Moving along, this will be just a quick little overview of these exercises. And as I said, the full-length ones will be emailed to you when you register. This is an anterior and posterior tilt. So we're basically tilting and tucking the pelvis. So tucking the pelvis is bringing your pubic bone towards your face or your belly button. And tilting the pelvis is pressing your sits bones, driving your sits bones into the ground and making space underneath your lower back. So as you tuck your pelvis, you're pressing your lower back into the ground. Tilting your pelvis is making space and tilting your sits bones back towards your back or towards the ground. This is really nice for contracting. So you're contracting as you tuck and you're relaxing as you tilt. Contracting as you tuck, relaxing as you tilt. I won't play too much of this because it's a little bit difficult to see even, but you can see my hips moving a little bit. So just remember to tilt and contract. That would be on the exhale. No, sorry, tuck and contract on the exhale. Tilt, make space underneath your lower back and relax your diaphragm and core. And that breath can be reversed, which is very cool. And it's not a absolute in one way or another. You can learn it one way and then reverse your breath and receive different feelings and different benefits from that. So just definitely explore that movement. Here's another example. This is a pelvic clock. And in this video, I talk about your pelvis as like a rectangle. Think about it like your pelvic girdle has your hip bones at the top that are, I'm touching in this video, you can see in the still, those are my hip bones, right? What we often refer to as our hip bones. And then we have our sits bones that are touching the floor. So if you think about those four bones and giving each one an opportunity to drive toward the floor by tilting and leaning, tilting, tucking, leaning appropriately, to drive the one bone at a time towards the floor and moving in a clockwise direction or a counterclockwise direction, even though it's a rectangle. It's basically a hip rotation on the ground, and I call it a pelvic clock. We're going. So as you're tucking and tilting, you're moving and shifting your weight, and you're not trying to be still about it. You definitely can move your knees, your other parts of your body, just kind of move along, but you're really focusing on driving those individual bones towards the ground, giving each one an opportunity. And through that, you're shifting, through the shifting of your weight, you're engaging the different sides and different layers of the pelvic floor as you're moving in either direction. And it's a very safe movement because there's no weight bearing. All of these exercises are safe to try now, even if you are in, well, I shouldn't say that. They're safe if they feel good, and if you need help, please seek the help of a physiotherapist to guide any exercises that you might need for your body specifically. So the pelvic clock is another lovely one to get a lot of movement going in your pelvis. This is a spinal flexion and extension. This is great always for anything for people to encourage more mobility in their spine. So remember how the pelvic floor is attached to the coccyx. So that's part of our spine. And what I'm doing here is I'm leaning back, I'm tucking and tilting again. It's a common exercise or movement that you'll see with pelvic health exercises. I'm moving to the back of my sits bones as I'm flexing my spine, and I'm moving to the front of my sits bones as I'm extending my spine, using my hands as leverage so that I'm able to relax and flex my spine as much as I can. I'm moving into extension, also using my knees to pull. You can do this in a seated position and have your hands behind your knees. So if sitting in a seated position isn't comfortable for you, there are options that you can utilize in your different positions. So when you go into flexion, you want to flex as much as possible, and extension, extend as much as possible, and you're rocking back and forth on your pelvic girdle, and tucking and tilting happens naturally here. You're providing a little pressure into your hips, which helps with your hip mobility, and really getting into the mobility of the spine to support the pelvic floor muscles. I love that one. I do that daily. This is a hinge with breath. And if you're familiar with Romanian deadlift or just a simple hinge, what we're doing here is we're pushing our hips, sits bones, sorry, I keep saying hips is kind of a general thing, pushing our sits bones towards the back wall. There's a wall behind us, like sticking out our butt as far as we can as we bend over. So we're not squatting, we're hinging, trying to use the hip as a hinge, like a door closing or opening. And as we're pushing our hips back, we're relaxing the pelvis and inhaling. And as we stand, we are contracting the pelvic floor and exhaling. As you hinge, so we're going nice and slow, hinging back towards the wall behind you. You can run your hands down your legs, or you can pretend you're holding onto a bar like you're doing a Romanian deadlift. And you're relaxing here, inhaling. And as you stand, you're exhaling and trying to engage the pelvic floor and moving it up towards your belly button like we were doing the connection breath. So we're pairing the connection breath with the hinge in this case. So again, feet hips distance apart. As you hinge, you stick your sits bones or your derriere towards the wall behind you. Try to hinge at the hips. Keep your chest proud as you lean over. You're not folding over. You're hinging, straight spine, and as you stand up, you are engaging that pelvic floor and pulling it up towards your belly button. It's a lovely way to use the hinge with the breath. In this next video, this will be the last movement video. This is a kinetic squat with our breath. So again, we're pairing the connection breath with the kinetic squat. A kinetic squat involves using your tissue on the top of your thighs, engaging that tissue when you pull yourself down into your squat, and engaging the tissue on the back of your thighs and in your posterior chain to push yourself up. So you're thinking about your knees pulling towards your, excuse me, your knees pulling towards your chest as you're lowering down and pushing through your heels to stand and engaging everything on your posterior chain. And the breathing, so this is a lot of cues, right? So the breathing also involves inhaling on your lower and exhaling, connecting with your, pulling up your pelvic floor on your exhale. Inhaling and lowering down, and exhaling and engaging your pelvic floor on the stand. And if you don't want to think about engaging the fronts of your thighs versus the backs of your thighs, and you just want to pair this with the connection breath, that's lovely as well. Any movement that you can coordinate with that breath will be great for your pelvis and your pelvic floor. Okay, I think I'm going to stop that one. I feel like we have definitely talked about a lot of movement that you have available to you right now. A couple of other exercises that I love that impact the pelvic floor. Supported child's pose. If you're familiar with yoga, you know about a child's pose. Supported child's pose involves just having a stack of blankets or pillows to support your chest to lay down onto. So you make your knees nice and wide, and you can collapse onto this lovely supportive pile and relax there. It is beautiful. It's a beautiful way to relax your pelvis, because remember, it's important to be able to relax your pelvic floor, just as important to relax it as it is to contract it. So it's important that you practice that as well, so that it's not always, you're not always walking around tightening it. It needs to be able to relax for proper function and contract. So also a supported bound angle. A bound angle is when your feet are together, you're laying on your back, and you have pillows underneath your knees as they fall open. So finding nice piles of pillows to have and to support your knees and really let that pelvis relax in that position. That's a lovely one. Cat and cow or spinal segmentation. Because our spine is connected to our pelvic muscles, it's important that we have mobility in that lower spine as much as possible, and we're getting that. It's important to maintain that spinal mobility and increase it. For most people, we need to increase it. Hip cars, if you know me, you know I love mobility. So cars are controlled articular rotations. Moving those hips through the full range of motion helps to also strengthen the pelvic floor. Romanian deadlifts with weights are great, and squats, deep or weighted squats, are also lovely for the pelvis. So that's it for all of the exercises and the information. But before we close, I wanted to ask if it was okay if I share my current program with you, just a little bit real quick about what I'm offering and how to get in touch with me if you like this content. that I've provided. This is an example of one module that I have included in my 12-week course that's called Optimize Your Pause. It's a 12-week on-demand menopause fitness intensive designed to ditch the yo-yo diet and activate your self-love. There's so much more involved with Optimize Your Pause. It is a really wonderful program. I'm getting great feedback from the clients who are engaged. It involves one-on-one coaching as well as group coaching modules that you can navigate on your own time, but definitely also the community aspect and the one-on-one aspect to make sure that you are driving towards your goals that are specific to you. Also, I'm offering 360 coaching. It's a 4-week one-on-one coaching experience tailored to your unique goals and fitness level. So I'm here to discuss all of it. Please go to themovementpath.com for full descriptions. I'm offering significant discounts for those of you who have joined live or are watching the replay. Just mention that you've watched the Lunch and Learn on the pelvis, and I'll make sure to give you your discount. So please, if you are a fitness professional or if you have any questions for me at all about referrals, please reach out anytime. Here is my booking link. You can book a complimentary call with me. And yeah, if you have any questions at all, I'm here for it all. It's a 15 to 30-minute call that's completely complimentary. So whatever you'd like to discuss, I'm here. I want to say a big thank you for your time and attention. Again, to receive full instructional videos, whether you have joined live or watching the replay, registering will get me or enable me to send those videos your way pretty easily. And I hope to hear from you soon. Remember, whatever you do, to keep moving. See you soon.